Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Real glad that you could join us once again. Going to be speaking with Dr. Harvey Kaufman this morning, Senior Medical Director and Head of the Health Trends Research Program at Quest Diagnostics. He's joining us to talk about a recent study of the skyrocketing increase in the use of heroin and fentanyl, as well as dangerous drug combining, especially during the onset of the pandemic. Welcome to Health Professional Radio, Dr. Kaufman.
Thank you, Neil.
Senior Medical Director and Head of the Health Trends Research Program at Quest Diagnostics. Give us a bit of your background and then give us some insight into your role there at Quest.
Sure. I've been with Quest Diagnostics for nearly 29 years in a variety of roles, and one of those roles is leading the Health Trend team. We've looked at the misuse of drugs for at least 10 years, and we have an additional complementary study called Drug Test Index, which has been produced for more than 30 years, looking at primarily pre-employment drug testing. Mm-hmm. So we have a long history of assessing testing for drugs and drugs of abuse and sharing our insights with the public.
This rise, as you indicate, a dramatic rise in the use of heroin and fentanyl, is it because of the pandemic, or was there a rise trending already?
Yeah, Neil, so there's been a rise, particularly in the use of non-prescribed fentanyl for at least, I would say, 6 years. I sort of caught attention to this, I think, in early 2015, when we were looking at about 5,000 overdose deaths a year, of which were associated with fentanyl, which is a synthetic opioid, very powerful, considered 50 to 100 times more powerful than morphine. And last year, I think we were in the 35,000 deaths, and I wouldn't be surprised if we surpassed 50,000 deaths this year, which would be approximately a tenfold increase from just 6 years ago.
How long's fentanyl been around?
It's probably been around for at least a decade. Mm-hmm. What changed was the combination of fentanyl with other drugs. So people who prepare drugs are mixing it in with heroin, cocaine, and other drugs to accentuate the effect of the combination of drugs more so than the single drug by itself. So what we saw in an unadjusted, just looking at the data, was a 35% increase in the use of non-prescribed fentanyl during the early months of the COVID-19 pandemic. And for heroin, it was 44%. When we make adjustments to the model based on shifts in testing, it's even more dramatic.
The testing that we're talking about, are we talking about pre-employment? Are we talking about court-ordered testing for this, that, or the other reason, for legal purposes, across-the-board testing for reasons that a person might come to the ER? Where are we seeing this huge increase?
The report that this study is based on is looking at testing that's ordered by physicians. So these are typically patients who are prescribed a drug, and the doctor asks the question, is the patient taking the drug that's prescribed? And approximately half the time, the patient is either not taking the drug that's prescribed or taking a drug that wasn't prescribed. So part of human nature is we aren't always truthful, and particularly when it comes to things like taking illicit drugs. So that's why testing is essential. And if doctors are going to take care of us, they need to know the truth. And if we're not going to tell the truth, the drug testing data does. So it's an objective way to determine really what's on board in each person, each patient.
As far as being dishonest goes in test subjects, has there been a decrease in testing, period, because of the pandemic?
Absolutely. So various groups, including the Centers for Disease Control and Prevention, urged physician offices and clinics and hospitals in the early part of the pandemic to close for routine health care so that we could focus our energies on the early surge, the patients who were flooding the hospitals and many who died. So that was an appropriate step. And then we learned how to open up in a safe way in terms of offices and clinics and hospitals. And many people have come back, but not all. So we saw a 70% decline early on in our test volume relative to 2019, and then we saw it rebound, but still well below the baseline of 2019. That has repercussions for other things. So although, the subject here is drug testing, we've also seen dramatic declines in the screening for hepatitis C, for chlamydia and gonorrhea, for virtually everything in healthcare has gone down, other than testing for obstetrics for women who are pregnant. So that has repercussions in terms of people just not going to the dentist, not having their mammograms and colonoscopies, and the impact is that there will be people who are missed, and it will present at a later stage that will be harder to treat, and the outcomes are going to be a bit worse.
How can we determine whether or not the surges that we're seeing in fentanyl use, heroin use, testing for hepatitis C, how can we be sure that these surges aren't surges of testing as opposed to actual surges in use?
Great question. So we went ahead and adjusted our model based on the shift in testing in the pre-pandemic versus the pandemic period, and actually the positivity skews even higher than what we observed. So in the unadjusted model, it was a 35% increase. In the adjusted model, it was a 55% increase. Now, Neil, another thing we observed that's key that hasn't been reported by others is really the combination of drugs. So the individual drugs is clearly a major problem, a crisis, but it's the combination which often is the deadly combination. So combining opioids with benzodiazepines suppresses respiration. We all like to breathe. Suppressing respiration is a bad thing. It can lead to death. And so the FDA has put black box warnings on both classes of drugs to suggest to doctors not to prescribe both together. Mm-hmm. What we have observed is that these combinations, which are often deadly, have risen dramatically, particularly during the pandemic. So we look at non-prescribed fentanyl. When there's a 89% increase when it's with amphetamines, with benzodiazepines 48%, with cocaine 34%, and opioids 39%. So not only are we seeing these surges in the individual drugs like heroin and non-prescribed fentanyl, but it's the combination that's also extremely problematic.
So do you think a surge in awareness is the key? Because when we're talking about the world of non-prescribed drugs, it seems par for the course that the people supplying non-prescribed drugs would do whatever they could to make as much money and to keep as many people addicted until they die as the end game.
Yeah, so there's a lot of things we can do. One is raising awareness is key. Unfortunately, as states in particular have had budget shortfalls or anticipate budget shortfalls, there's been a decrease in support for medication-assisted treatment and a decrease in substance use disorder facilities. So that's just as the need has exploded, the funding has come down. The other thing that we can do is a lot of this is driven by loss in jobs, the social isolation that's part of the pandemic, depression, some anxiety over the election. All these things add together to make life more challenging. And so we can reach out to each other through social media, through phone calls, socially appropriate visits, to support each other so that those who are lonely, those who are depressed, those who are prone to using drugs have a social support structure that will help avert overdoses and deaths.
Well, Dr. Kaufman, where can we go online and learn some more about this study and raise our own awareness of this increase in the combining of these two drugs?
This study is available online. It's publicly accessible. It was published in Population Health Management. Someone can go to that website and look for it. In addition, there was a recent study in the Journal of American Medical Association that also looks at drug overdoses during the pandemic. And I think it was just last Friday that the Metro Public Health Department, covering Nashville and Davidson County in Tennessee, released data showing dramatic increases in drug overdose deaths, in overdose ER visits, and in suspected overdoses. There's a wealth of resources. And the last place I'll mention for the study is on the Quest Diagnostics website under Quest Diagnostics Health Trends.
Well, I appreciate you joining us here on Health Professional Radio this morning, Doctor. Thank you so much.
Thank you, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com, Health Professional Radio.